The BayScribe Care Team dashboard offers unprecedented speed for case managers to be able to find different patients in the facility or across a spectrum of facilities with certain conditions. If I log in, I can quickly and easily find all the patients that have reports that reference CHF or congestive heart failure. If I wanted to look across and say how many of the patients in our population have a reference to diabetes, I can do that with great ease. Now, some of these patients might not have diabetes themselves. They might have a family history of diabetes. So a second filter that's a little more granular is diabetes with no family history of diabetes. And you can see there are in fact fewer patients that have diabetes themselves. I can also take a look and say, well, do we have any diabetics that have a history of non-compliance with their medications? And in fact, we do. And if we take a closer look, sure enough, we find a patient that has reference to non-compliance of their medications. While I'm in this report, I can look at not only their problems, but I can look at different medications they take. I could look across at allergies, immunizations, and procedures. A great deal of information, as well as looking at not just their H&P, but also the consult note that took place when they arrived. Different consults that were obviously ordered throughout the course of the stay, all the way through to the discharge summary. When the discharge summary is completed, from there we can generate a level 3 CCD, continuity of care document, so that we can share this information in the EHR and also out onto the HIE. So creating interoperable documentation from unstructured text is what we're doing by way of natural language processing and industry-leading terminology codification from IMO. Other uses for this would be simply going to say how many patients in our population have an allergy to penicillin. And it's as easy as doing a couple of mouse clicks, and there the patients are. And if we take a closer look, we open it up, we go to the allergy section, and sure enough, there's our penicillin allergy. So a great deal of speed and ease identifying patients for case managers. We hope you'll take a closer look at